Hey there, Facebook friends. Thank you for joining us tonight as we talk about back to school safety. Today we're here at Christiana Care Primary Care at the Concord Health Center up in Pennsylvania. Joining us today is Dr. Ray Carter. Dr. Carter, thank you very much for joining us this evening.
Thank you, Megan.
Why don't you start by telling everybody a little bit about yourself?
Sure. I'm board certified in pediatrics as well as adult internal medicine. I've been with Christiana about 11 years to my training and then as an attending for the past 7 here at Concord Health Center. We have a practice of board certified pediatricians and adult internal medicine physicians. We have a wonderful new facility here where we have lab services and medical imaging and a whole host of subspecialists here. So it's a great place to work.
Great. So before we get started, if you have any questions during our conversation, I am keeping an eye on the Facebook page. So please just send in your questions, your comments, your concerns in the comments under this video, and we'll ask Dr. Carter your questions throughout our conversation. So school starts, for some people school already started, for others school starts in the next week or two, so it is prime physical season.
Sure.
I'm sure you've seen your fair share of physicals over the last few weeks. How important is it for our viewers to make sure that their kids get their annual physicals?
It can't be understated how important it is. It's a wonderful opportunity for you to have a lifelong relationship between your child and your medical provider. We talk about a whole host of things. It's not just about sickness, although identification of medical problems is definitely a part of it. But we talk about development, whether it's speech or social, language, growth. We talk about nutrition. We talk about safety in terms of prevention of injury as well as prevention of illness. Vaccines play a huge part of that as well. And we hope to guide parents through their kids' ages and stages, different portions of development to make sure that they're growing and safe.
So a lot of people intentionally go specifically for sports. You know, football starts, need those papers signed. What is the difference between an annual physical and a sports physical?
Sure. There's a lot of overlap between the two. So sports physicals, we tend to think of a pre-participation physical. And what we're talking about is being safe and being as safe as possible during sporting events, whether it's any type of sport. And different sports have different levels and types of risks. So we want to address those and prepare the family to make sure that it's fun and it's happy, but it's something that's done as safe as possible. We talk about lots of different things in terms of family history, so those things may pose additional risk for children, the type of sport that you're playing, and the health history, so being acquainted with all that information is really important.
So what should parents expect during physicals? You know, for a lot of kids, that's not necessarily in the top of their summer list of things to be doing. So what should the parent expect, and how should they prepare their child for this kind of physical?
Sure. I think for the sports physical, it's for those things that I just mentioned. Just know that we'll be doing kind of more different types of physical exam findings to make sure that the child has all the ability to use different body parts and that it's safe to participate. So just know that we'll be doing a range of various physical maneuvers and talking about things. It's not all that different from a well child check. And
even a well child check, is there kind of main tips for making sure that your child doesn't totally dread coming to see you?
Yeah, I think making sure that you have the discussion and setting some degree of expectation, and that depends on how old the child is. So for real little kids, role play is helpful. So pretending to be the doctor as the parent can be helpful with the child, and sometimes using a doll or a pretend doctor kit is something that helps kind of make the situation a little bit more comfortable. And then for adults and children, nobody likes to be surprised, so talking about what's going to happen. And there might be a blood pressure cuff that squeezes you. You might be asked to look in the mouth and the ears, and doing those things helps kind of disarm the child and make it less of an experience for them that might be considered scary. And being upfront with them about vaccines as well. You know, the last thing that you want to do is surprise the kid or something of that nature.
Yeah, considering I'm sure many kids' shots is definitely the least enjoyable thing of their visit. What exactly, for the kids who say, you know, I don't need shots, I'm fine, you know, why is it so important that they do get the shots during the physical?
Right. Immunizations are really important, and this practice, among all Christiana practices and the medical institution in general, feels vaccines are just incredibly important. Probably vaccines and antibiotics have been the most powerful, helpful things to prevent illness in the history of medicine, the history of mankind. There are so many very tragic and horrible diseases around the world that we don't see in this country nearly as much because we have vaccines that keep kids healthy and safe. And we know that these vaccines are tested, they're tried and true, they're very safe, and the risk of a vaccine is incredibly, incredibly small compared to the risk of being exposed to the actual disease.
Even flu shot, you know, we know we're having our big flu shot campaign starting internally in the health system.
For sure,
flu shots it's almost, you know, prime time to be getting your flu shot.
Yeah.
How important do you think it is if, say, one child gets a flu shot and your other child doesn't, is it better that both of them do? Is one more susceptible to it? There are a lot of questions around how important that is.
Yeah, I think it's incredibly important for kids to be vaccinated for influenza. Every child and adult, a child over the age of 6 months should be vaccinated against influenza, and certainly all adults are, as it's a very harmful illness that we see every year after year. In terms of one child being vaccinated and the other not, I mean, anyone who can get the vaccine definitely should. It's the healthiest, it's the smartest thing to do. We know that vaccines, just like anything else in life, aren't perfect. They don't work 100%, but you can reduce the risk of getting influenza by up to about 80% per year. And even if you still do get influenza after having vaccine, the risk of it being a more serious illness goes down dramatically.
Great. So student is here, they've had their physical, they've had all of their vaccinations, they've had the flu shot.
Yeah.
But there are still other things, day to day that parents can do, like vitamins.
So there's maybe not a whole lot of 100% agreement on vitamins, just like anything else. But most pediatricians and the American Academy of Pediatrics would say that vitamins or multivitamins aren't necessary as long as the children get a good intake of a broad, balanced diet. And so unless the child has a specific medical condition that might prevent them from maybe absorbing certain things from their diet, most kids who have a balanced diet are going to get the things that they need, and multivitamins aren't necessary. That being said, most pediatricians would also agree that they're not harmful unless done above and beyond what's recommended on, let's say, the bottle. Vitamin D is something that children frequently are not getting enough of these days, as we make sure our children are protected from the sun and wear sunscreen and sun clothing. So it is recommended that all children get 400 or 600 units of vitamin D, depending on their age. But that could be just as easily obtained with dietary choices rather than a supplement or a pill.
So if parents are watching and saying, okay, vitamin D, what can I feed my child? What has vitamin D in it? What would you suggest?
Sure, naturally, like eggs and fish have vitamin D in it. It's fortified into a lot of things that kids eat, like breakfast cereals are fortified with vitamin D, as is milk and orange juice and some other things that kids will commonly get. So it's pretty ubiquitous in a normal child's diet.
And does that tie into the importance of just eating breakfast in general?
Oh, for sure, yeah. There's a lot of research that goes into how important breakfast is, and breakfast is really important. Breakfast is huge. Just as an adult, being hungry is so distracting, but regular breakfast has been linked to better academic performance, better concentration, less sleepiness, overall better balance, healthy body weight. All those things are tied to a healthy breakfast.
So what about lunch? Some people pack lunch. Some kids are really into the pizza that you get in the lunch line every Friday. What would you suggest for parents who are now trying to, this weekend, go to their Acme, their Giant, their Food Lion, and start packing lunches?
So I think for the kids who are old enough to participate, the most important thing is, if you can, bring your kids to help participate. There's a lot of information out there that shows that kids who participate, and sometimes if they're old enough and safe enough to participate in the cooking of their foods and the packing of their foods and the preparation of their foods, are more likely to eat that stuff. And you want to keep it diverse. I think children respond well to choices. Every time you prepare a meal for a child, you want to make sure that they're getting something that they like and will have some of that, and maybe challenge them a little bit to have things that they maybe aren't as comfortable with, but will help keep their diet very diverse. You want to include proteins and starches, but also fruits and vegetables. Keep it colorful and have fun with it.
It's great. So now that we're talking about being in school, we do have a question from one of our viewers.
Okay.
Kelly B wants to know, what's the best way to prevent children from picking up illnesses at school?
Oh, that's a good, thanks Kelly B for that question. I think there's a number of things you can do. Some of this is kind of the bread and butter, the basics of care of a child. So making sure that they're well rested, that they're getting their 9 hours of sleep or more a night, that they're getting a good balanced nutrition, a good balanced diet to keep their immune system up, to making sure that they're exercising, that they're active. So all those basic tenets are huge for prevention of illness. Washing their hands, right, to try and decrease exposure. To try and, your own kids, don't send them maybe to school with illness to necessarily spread that to other people at school. To do all those things is probably the most helpful thing. And in the end, it's okay for kids to get sick. Of course, we don't want them to be, very sick. Illness sometimes is not preventable, and it's okay. It makes the immune system stronger.
So if anybody else has questions, we are tracking the questions that you send in on Facebook. So just throw your comment, question, concern in the comments under this video, and we'll ask Dr. Carter during our conversation.
Great, thanks.
So they're at school, they're eating their packed lunch that they helped put together, and they're trying to wash their hands and stay away from everybody.
Okay.
What are kind of the go-to for, what do you tell the students? We just kind of told the parents what they should be doing. What is your go-to conversation that you have with your child to make sure that they are remembering to wash their hands and they are remembering that they should be making these smart decisions? What are kind of the top things that parents can say to their children?
I don't know if they necessarily need to say anything, but I think their actions will probably speak just as loud or louder than their words. So when we talk about nutrition and what's important at lunch, that's a good example of one of the 3 meals that kids should be having. So if we incorporate healthy habits, if we practice eating together as meals, as a family, as we talk about washing our hands before and after we use the restroom, as we talk about healthy eating habits and we demonstrate that for our children, if we're doing all those things regularly, there's not so much you need to tell the children specifically to keep them healthy. They're just going to follow the things that they've already been doing in general.
So what is good ways, some students just automatically, they wash their hands, they have everything, they just have seasonal allergies.
Right.
So for the students that you see that are battling those allergies, what are recommendations to kind of either just help them not have be the runny nose kid, in school?
Yeah.
Or stop them from, picking up other illnesses on top of that?
Sure. So it's definitely lots of children have allergy season different times of the year. It could be spring or summer or fall or even winter. And so there are seasons that are harder for some kids than others at different times. And so avoidance is probably the best thing you can do. We can't live in a bubble, but if we can avoid exposure to things. So if certain children are, let's say, allergic to grass or grass pollens, fresh cut grass or participating in the grass cutting maybe isn't the activity or the chore that you want your child to be doing. So avoidance is something that is partaken if you can do so. And then there's a lot of helpful things that can be available, such as over-the-counter medicines. There's non-sedating antihistamines that you can talk about your provider with, as well as some nasal preparations, nasal sprays that are very helpful to keep allergies at bay for those kids who are suffering more.
All right, if there is one topic that you think is kind of most important for kids in school, what would you say is kind of most important going into that first day of school next week?
Have fun, right? So fun. School's a wonderful activity. We're gonna learn a whole host of things, but have fun. You want to make sure that the child is well prepared. You want to make sure that you've discussed kind of the things and expectations, and then you celebrate those things when you come home. So it's an enjoyable experience for the child. That should be the most important thing.
That's great. Well, thank you so much for joining us, Dr.
Oh,
Carter.
sure. Thank you.
If you have any questions that you haven't thought about, put them in the comments afterwards, and we'll be able to get them to Dr. Carter and then respond to your comments after the video. And if you are interested in primary care and any of our ChristianaCare locations, visit christianacare.org, and all of the information will be right there for you. Thank you so much for joining us, and we hope to see you in our next Facebook Live.